Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet three physicians who have recently joined Novant Health Family and Internal Medicine South Brunswick. Then, Sheila Priestley and Leanne Berkey of Novant Health's physical therapy team will join us to share more about this valuable service. And finally, Chris Harrelson of the Brunswick County Health Department will share information on the county's most recent health assessment. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Dr. George Bell of Novant Health Family and Internal Medicine South Brunswick. Well, welcome to the show today, Dr. Bell. It's such a pleasure to see you again.
I'm delighted to be here. Thank you for having me.
Oh, sure. You're quite welcome. Now, I know that we were at your practice not long ago and did the whole show from there, and folks got to have a tour of the facility and what have you. So today I want to get to know you a little better as well as your partner. And so let's start with learning about your background and your education. Tell me about that.
Oh, how many hours would you like?
No, just hit the highlights.
Okay. Well, I was educated in Illinois. We lived in northern Illinois on the Illinois side of the Wisconsin state line.
Okay.
And actually, the University of Wisconsin was closer to go to college, but because I was living in Illinois, it was cheaper to go to Illinois.
Sure. Oh, absolutely.
So I was educated at the University of Illinois, and then got on the bus with the classmates of mine and drove up to Chicago and went to medical school in Chicago. During medical school, I received a call from the Navy, and they offered me a scholarship to go through medical school, so I accepted that.
Oh, fabulous, yeah.
And I was sworn in as an ensign. So I was an ensign in the Navy through medical school, but I have to admit I never wore a uniform.
That's okay.
And then when medical school finished, I was, if you're on a military scholarship, when you go through medical school, you are offered a military internship. So I was really unlucky, and I got San Diego for my internship. So I did a year of internship at the Naval Hospital in San Diego. It was a brand new hospital that year. It used to be the Pink Palace, and then they had built a brand new facility, and I was the first intern class to go through that facility. It was just gorgeous.
Oh, that's great, yeah.
And did really well serving the naval personnel there.
Sure.
After that, with a military internship, then you have a choice. After that, you can actually go out into the military and serve as a medical officer, or you can go on and do the rest of your training and then go in the military as a specialist. Well, I chose to go into the military at that point and got assigned to the Marines. And I remember wearing a naval uniform, walking into the Marine Corps commanding officer's office the first day that I reported for duty at Camp Pendleton. It was there.
Yeah.
And he looked at me and he said, "I know that your uniform says Navy on it, but you're a Marine now." So I got assigned to Marine Corps Infantry as what they call a battalion surgeon, and I had corpsmen that worked under me. I was their supervisor, and they worked out with the squads of Marines. Well, during that time, the Marines travel a lot, so I got to the Philippine Islands,
Right.
I got to Okinawa, Japan, and Desert Storm started.
Oh, that's when Desert Storm, oh.
That was the first, sort of the first war in the Middle East that we were involved in with, I think, with Saddam Hussein.
Right.
And so I actually ended up going through Desert Storm.
Wow, that's
with
interesting.
with the Marines.
Wow.
And it was a very interesting experience, to say the least.
Yeah. Well, most recently, where did you practice medicine?
Okay, after I finished with the Marines, I finished my training in the UCLA system in Los Angeles, and so I was out west. And when I finished training, I had become familiar with the state of Idaho, and I found a town in northern Idaho that really needed internal medicine. So I set up my practice there as a private practice, right across the street from a hospital, and I was there for about 10 years. In the meantime, my parents were getting a little bit older, and they were back here on the East Coast, and they had retired to South Carolina, to the upstates on a golf course. So as they got a little older, I realized that I needed to come back east.
Sure.
And so I took a position in Charlotte and was there for about 10 years. And my wife and I grew accustomed to the coast, and we really fell in love with it. And so when this position opened up with Novant, I interviewed and thankfully got the position.
That's great. Well, I understand that you're board certified in internal medicine, and for our viewers who might not be familiar with that, tell us a little bit about what that means.
Okay. Board certification is available to most specialties. In internal medicine, it means that you have gone through an accredited internal medicine training program, which I did in the UCLA system. And then at the end of that, you take an examination, and if you pass the examination, you become board certified.
Right.
And then you recertify every 10 years and retake an examination, so it keeps you current and up to date on things. They're about ready to change that, I think. The American Board of Internal Medicine is about ready, I think, to sort of start doing a yearly thing where you just sort of, over a course of 10 years, recertify gradually.
With internal medicine, what would be the youngest patient that you might see in your particular practice?
Oh, great question. I get that question all the time. Internal medicine is mainly for medicine for adults, so we get about 18, age 18 and above. Occasionally we'll see a 17-year-old, but that's sort of pushing it.
Well, that's great information, and I know that your partners are family practice, and so we're going to talk to them in just a few minutes, and I know that they'll start seeing patients much earlier because they are family medicine.
Yes, they'll do some pediatrics and maybe even some newborn care.
Right. We'll let them tell us all about that then.
Great.
Well, thank you so much for being on our show today, Dr. Bell.
You're very
time
welcome.
goes so quickly, and you have such an interesting background. I'd really love to hear more about it. So maybe after a few years or a year or so, maybe we'll have you back on the show, and then you can tell us what's going on.
You bet. Maybe I can come tell my war stories.
That'd be great.
And put everybody to sleep.
That'd be great. No. Well, thank you again. It's been a pleasure.
Oh, thank you for having me.
You're welcome. Now, we'll welcome Dr. Stephanie Connell of Novant Health Family and Internal Medicine, South Brunswick. Dr. Connell, welcome to the show today.
Thank you.
It's such a pleasure to have you here, and we just spoke with Dr. Bell and learned about him and what his background and what have you, and now I'm really interested in you. So tell me a little bit about your education. Where did you go to school?
So I was born and raised in Oklahoma. I attended the University of Oklahoma and achieved a bachelor's degree in zoology and biomedical sciences. I then completed my medical training at the University of Oklahoma College of Medicine, and I just completed residency in Greenwood, South Carolina through Self-Regional Healthcare Family Medicine Residency Program.
Wow, so you're in family medicine.
Yes, ma'am.
Unlike Dr. Bell, he's an internist. And he talked about seeing patients at the age of around 18. So tell me about your patients. What do you focus on?
So historically, our clinic has seen 15 and up, but we are working very hard with our clinic manager to make it more child-friendly, and I'll be seeing children and adults of all ages.
Good. And that's kind of unique about family medicine, that they see the whole family. Is that correct?
It's great because you can see mom and the daughter and the grandmother and everyone. It makes a really nice dynamic, and I really love it because it allows us to really hone in on those families that unfortunately do have genetic things that run the family and other diseases, so we can try and prevent their children from having to face the medical problems that they now see their parents going through. So I love that about family medicine.
Mm-hmm. And also, I think, well, it's my perception that you learn a lot of things about the family dynamics, maybe by talking to one of the others in the family that might be affecting the patient that you're seeing at that point.
Yeah. It's great to be able to focus on the social dynamic also whenever you see family together. And health is a team effort. I mean, so making sure that everyone is on board with the household about eating healthy, exercising, not smoking really makes a big difference. And families tend to tattle on each other sometimes. So if they said they're only eating one cookie a day, sometimes you learn it's more like 2 or 3. So toddlers are usually the best about letting us know what's really going on.
They will tell you. So what led you to make the decision to move to our area? I mean, I know it's beautiful here and we have the beach and everything, but what was your personal story about moving here?
It was the beach. I have always loved the water since growing up, and when I was younger I wanted to be a marine veterinarian, and none of that has dwindled as I've gotten older. I love the water, and so during residency I tried to focus on being able to move somewhere near a beach and have those outdoor activities, and I just fell in love with the area. So I was really lucky to be able to have a position here at Novant to be so close to the ocean.
I think we're probably the lucky ones to get you.
Well, thank you.
That's awesome. When I reviewed your background, I noticed that you did a great deal of volunteer. You have a great deal of volunteer experience. So tell me about some of that.
I've been really fortunate to work with a lot of wonderful organizations. During undergrad, my focus was on Relay for Life and trying to work with their organization to not only raise money for cancer research, but also just awareness for the need for that. Most recently, our residency program actually teamed up with the local free clinic in our community, Greenwood United Ministries, that offered patients without insurance not only access to physicians and medical care, but also the medical supplies and prescriptions they needed. So that was a wonderful thing that the community provided. I'm really glad our residency program was able to participate in that.
Yeah, that is awesome. While you're here within your practice, is there an area, a specific area that you'd like to focus on?
Preventative care, that's what originally drew me to family medicine, is being able to not only focus on the problems that the patient has today, but trying to plan for a better tomorrow. And again, that goes with the family dynamic and being able to really try and look through the family history and things that have really plagued the family in terms of medical diseases, and trying to make a healthy today and a better tomorrow for all my patients.
You sound like you have a speechwriter. You're so good. You're so eloquent, and you say it so nicely. And I love the message.
Well, thank you.
Before we wrap up, is there anything else that you would like to share with our viewers out there?
I've loved the community. I'm really excited to start seeing them in the clinic and to be a permanent member of the community. So, thank you so much for having me here today.
Well, it's been my pleasure, and I hope we'll see you again after you've been here a while and see how it's going.
Thank you.
Thank you. Now, we'll welcome Sheila Priestley and Leanne Berkey of Novant Health's physical therapy team. Sheila, Leanne, thank you so much for coming today. It's a pleasure to have you.
Thank you for having us.
Sure. Now, I'm excited to hear what's going on in physical therapy with the Novant Health physical therapy team. So, for our viewers who may not have met you yet, let's share a little bit about yourself and your role with Novant Health. And we'll start with you, Sheila.
Okay. My name is Sheila Priestley. I'm a physical therapist. I've been a physical therapist for 17 years.
You don't look old enough.
Oh, but I am. But I am. I just turned my new decade. And I am the rehab supervisor for both inpatient and outpatient. So obviously our inpatient is here at Novant Brunswick Medical Center, and we're going to have we have our clinic in Charlotte and a new one coming soon in Calabash. So we're looking forward to that in the fall.
Yeah.
Yep. Looking
Great.
forward to it.
Yeah.
Sounds awesome. How about you, Leanne?
Well, I've been in the field for 27 years, and I just want to say about our team, I am impressed with how we genuinely care for our patients, and I love the background. Stephanie is a PTA, and Kelly also, and They all bring a wonderful background of nursing and orthopedics, pediatrics, and Kelly's a yoga instructor, so it's wonderful that we have that well-rounded care in our outpatient center.
So you're both physical therapists, but I understand that you have aides there also. Can you talk a little bit about that?
Sure, we have PT assistants at both our inpatient and outpatient sites. We have 2 full-timers and a few PRN assistants, all skilled in all aspects, both orthopedics, our balance, our geriatrics, our neuro patients. So they're there to help carry out a lot of the plan of cares, our treatments.
Well, it sounds like you both have significant experience, but let's start with the basics. Tell me where all of the Novant Health physical therapy services are located.
We have our inpatient at the hospital in Bolivia, and we have our outpatient clinic in Charlotte on Main Street near Walmart. It's 4503 Main Street in Charlotte. And our Calabash office will be right off of 17.
At the New Carolina Shores
right in Carolina
office.
Shores.
And when do you expect that to open?
Fall of this year.
Fall, okay. So do you both offer inpatient and outpatient services?
We both do them.
Yes.
But we primarily, Leanne is at the outpatient clinic right now in Charlotte. I float back and forth, but I've been kind of as a supervisor at the inpatient side. So,
So you're at the hospital primarily?
More so, yeah.
So tell me what types of physical therapy services are offered at both inpatient and outpatient.
Okay.
Mostly outpatient. We do anything from orthopedics to neurological cases. We see pediatrics for various maladies, and I was recently certified in balance management and assessment at the American Institute of Balance. So we treat anything from Meniere's to the acronym is BPPV, which means positional vertigo. Yeah, a lot of people get vertigo.
So if I'm just it's kind of dizzy or having spells like that and I lose my balance, that would be a reason to have the balance.
Sure, June. And a lot of times if it's just positional changes, we can change that in
like sometimes when you stand
minutes.
up too fast.
Right. We'll take a look at all
Well,
that.
that's good. Well, how about on the inpatient side? Then what services do we offer at the hospital?
Inpatient has just a little bit of everything, the big mix. We have our, our typical orthopedic surgeries, our general surgery patients, any medical. We have a lot of our geriatrics, respiratory disorders, our neurological patients, whether it's Parkinson's or stroke. We have a whole array that we cover. Our fall patients, dementia patients.
When I think of physical therapy, I think in terms of hip replacements, knee replacements, but it sounds like you treat specific conditions also. You just mentioned stroke or dementia, things like that. So I guess it is a bigger.
It depends on the need of the patient, and a lot of the times the physicians will go in and they'll evaluate a patient that may come in for generalized weakness, falls at home, and such like, so we'll just go in and do our basic assessment, find out what the patient's needs are and treat them accordingly. So
Sheila does it all.
Leanne, what would you say the most common condition is that you treat?
I would have to say it would be lumbar pain, low back pain.
Oh.
We get a lot, especially with the amount of golfers in our area, young and old. We get all ages. And next from that, I would have to say balance issues, dizziness issues, vertigo. And
Oh, that's interesting.
yes.
And how about on the inpatient side? Is there one that stands out?
I
think there's a fair amount of orthopedic surgery
I was
there.
going to say definitely with our surgeries, because we're full of orthopedics in this county. But definitely, I think falls are a big thing, because that's where a lot of our older population are coming into the emergency room. So we're getting a lot of falls. But I think, you know, that whether they're stroke or mini strokes, the TIAs that come through. And we have the respiratory disorders and a lot of the COPDers too. Yep.
Does physical therapy require a doctor's referral?
We have direct access, so not necessarily, but a lot of the insurance companies require
that
it for reimbursement and payment. So if it's something out of our scope of practice, we refer them to a doctor, but typically we do recommend it regardless.
Well, if viewers of ours would like to schedule an appointment or need more information if they have questions, what would be the best way to access you guys? At the hospital, perhaps, or
probably directly to the outpatient clinic. They can call, and the number is 910-721-3157. And they can, you know, if they need to.
Would they need to speak to, for instance, Leanne, or?
We do have ladies that answer the front desk, so they will be the first line there too. And if at all, if they needed to contact and speak with Leanne, they could request.
Because if they just have questions about, you know, I think I might need this, you might be the better person to talk with. And so, and again, that phone number was?
910-721-3157.
Great. Well, thank you so much for coming today. It's been a pleasure to have both of you. I'm interested in learning more about that balance thing. So
it's up and coming, and we're trying to grow that too. And we'll be offering a lot out there for the community. I mean, we're going to be touching upon a lot of things and looking further to with training and different modalities and things like that to provide to the community. So
great.
Looking forward to it.
Well, thank you both for being here today.
Thanks
it's been
so
a pleasure,
much,
and I hope to talk with you soon.
Thank you.
You're welcome. Finally, we'll welcome Chris Harrelson of the Brunswick County Health Department. Welcome to the show today, Chris.
Thank you for having me, June.
It's a pleasure to have you here, and I know that you're going to share some really good information with us. So let's start by you telling me about yourself and your role with the health department.
Okay. Well, I am a Bladen County native,
really?
But have long-time ties to Brunswick County. I've been coming to Brunswick County beaches, our family's owned property here, since I was about 10 or 12 years old. So it's been like a second home to me.
Great.
I've worked the last 22 years in public health, the latest being as Health and Human Services Director in Bladen County, but then assumed the Director of Health Services duties in October of 2015 here in Brunswick. One of my better decisions in life. Glad to be here.
That's what I always say. We moved here quite a few years ago, and I just wish I'd done it when I was like 12 instead of, you know, it's just so nice here. We absolutely love it.
It's great people here.
Yeah. Well, today I want to focus on the Community Health Needs Assessment, which we at the hospital have been very involved in, and it was recently conducted in Brunswick County. So, again, we were really proud to partner with the health department on this initiative. So let's start at the beginning. Tell us what the needs assessment is and how that is conducted.
The Community Health Assessment is a collection and analysis of the data concerning the health of the county. And we collect that data in two primary ways. The first way is through a survey that we send out to the community, all the municipalities, all the communities within Brunswick County. And we ask them specific questions about their health, their demographics, and what their concerns are about the state of the health in Brunswick. After we get the data back, we examine it, and if it appears that there's one area of the county that may not be represented properly, we'll go out to those areas and do town halls or little community forum meetings to make sure that they do have a voice in the community survey.
Uh-huh.
The second method that we use is actually looking at statistical data that we pull from local, state, and federal resources, such as the CDC, the National Institutes of Health, some of our own local data here, and U.S. Census Bureau could be one. So once we get all this data in, we gather a team of community partners.
Right.
And Avant was part of that, and we appreciate your help and your input on that. But that team is called the Community Health Assessment Advisory Team. And that team sits down and they look at the data and they compare the data to the state of North Carolina,
Okay.
to 3 peer counties to Brunswick County,
Okay.
and then also to ourselves, what the last community health assessment showed us about Brunswick County. And then after they compare the data, we'll determine the top 3 health priorities within the county, and we'll develop a strategy to address those in the coming years.
Well, how often is the assessment conducted?
Every 4 years, and in the years in between, we release a report on the progress that we're making
okay.
towards those goals.
Can you share some of the key learnings that, that you have from the assessment?
Right. When looking at the data from the surveys, these are our community residents' our opinions about the state
Yeah,
of
because
health.
it is just their opinion, correct?
Yes. They are concerned with drug and alcohol abuse, obesity, and chronic diseases such as diabetes
Yeah,
and
that's a big-
hypertension.
Yeah.
Interestingly enough, when we ask the question, what do you feel your community needs to be a healthier community, their number one answer at 42% was more jobs.
Really?
More jobs, yes ma'am. Which
That's
makes
interesting.
sense
That
when you
does
think
make
about
sense,
it.
yeah.
Because when a person works, they are improving their socioeconomic status.
They are,
And there is a tie with socioeconomic status and good health. And if they have income coming in, they are more apt to buy health insurance, or their employers may
Right.
provide health insurance for them. Either way, they're gaining access to health care.
And would that be one of your goals? I'm interested in the primary goals of the assessment.
Well, after looking at the hard data, the statistical data
Right.
that we got from CDC and other places,
Right.
The team determined that we have 3 priority items that we need to address. Number 1 is accidental death and injury, because
Okay.
Brunswick County has experienced a spike in that.
Uh-huh.
The other is mental health and substance abuse.
That's a big
because, just like other counties in our region and
Right.
across the United States,
Yes.
we're experiencing an increase in drug and alcohol addiction. And the other is chronic disease management. We've made some great strides forward with preventing chronic diseases and with managing it, and we don't want to drop the ball on it. We want to continue to move forward.
Well, one last question. Is it possible for the community to access this, the assessment?
Absolutely.
Is it online? or-
It is. It's on our website, which is www.brunswickcountync.gov. They can also come to our office at 25 Courthouse Drive, Bolivia, and we have hard copies.
Well, that's great. That's great, because there's some interesting information in
It
that.
is.
And so,
Well,
yeah, I
June,
think it's very worthwhile to go out there and see
it
what it
is.
says.
And I consider myself blessed to be in this position
Right.
where I can work with great community partners, the healthcare leaders within Brunswick County, and we can put resources towards these issues because we all want a healthier community.
We do. And the health department goes above and beyond. I will say that the health department does a fabulous job in Brunswick County.
Thank you so much.
And thank you for being here today. It's been a pleasure to have you,
It
and
has
I
been.
look forward to seeing you again. Let's don't wait 4 years, though.
That's right.
We'll come back and talk about the action plan. How's
Yes,
that?
sounds great.
Great. Well, thanks again for being here.
Thank you.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.